There's no way you can think of any community in Botswana without thinking about HIV. It has changed the society, it has changed the culture, it has changed the economy, productivity, social interaction. It has touched every component of our lives. If we did not have HIV, our economy would be 40–50% better than what it is right now.
Botswana has the second highest prevalence in the world. And at the moment, it is actually recorded at 18.5, which when you extrapolate it is 1 in 5 of the total population. So the question then remains, why do we still have this many people infected every year? It's because people are not preventing, or people have become complacent.
You know, if HIV had feet, we'd actually see it walking. I think this is a battle that we've been trying to fight for a long time. But sometimes we're fighting a battle that's not bringing anything to us. We're not winning.
What we know is that condom is the only barrier. We don't have any other barrier, and therefore it's a very important commodity for preventing HIV.
No one should get HIV because they couldn't afford a condom.
We all know that having sex is natural, and it's something that is, to me, is a human right. So you have to have enablers to allow you to have sex in the safest way. And the best way that we know right now is the condom. There's no other way around it.
The access of condoms is not at 100%. We have local clinics. You go to these local clinics for free. You don't pay anything. Sometimes you're asked to pay. If you don't have money, then you can still get assistance. But the thing is, the supply that's there is quite limited for everyone to get. So la re ga diwa mo ditleliniking ya shota le mo dikgotleng.
We tell di shota le gona ha ga diwa ma ke maloba ne ke re ke a kopa ke thala go se.
So ke yone mabaka a yona gore re ka tsara akanya gore ke yona irang gore batho gantsi ba tlhakane dikobo go sena condom.
Ka gore we thala le gore ga ba di bone ka nako tse dintsi wa bona. Tse di bonwang ke tse di rekisiwang ya le tse di turang yana. Ke bona gore go ntse.
Ideally, you should be able to get them anywhere when you need them.
To your knowledge, are these clinics and other places where you can get free condoms adequately stocked?
As of right now, I would say no.
This is a clinic, so we keep our condoms there most of the time, where the drugs are. We use the small boxes because people don't want to be seen picking condoms. We pack them like this.
Male accept condom, but they complain sometimes, the quality. Others are coming like here, complaining that the condom is broken.
The problem is, I think most people perceive that things that are provided free by government are of a lesser quality than something that you buy in the shop. And that is a problem.
The Lorato condom was definitely shunned and definitely not accepted by the public. If you're going to sell a condom or you're going to give a condom for free, you need to be able to brand it properly such that it may speak to the user.
And providing a condom would mean it's something that would help in the efforts of stopping new HIV infections.
Having secured a substantial distribution deal with Australian retailers, Hero travelled to Botswana to pledge their first major donation of 500,000 condoms.
Hero has plans for long-term distribution in Botswana, working with the government, working with NGOs on the ground, working with the National AIDS Coordinating Agency to make sure that good quality condoms reach people.
Hero met with NGOs, community groups and government organisations. Their aim was to ensure that there was effective distribution and to gather feedback on the product in the communities that need them most.
My name is Salim Kyohodile. I describe myself as Botswana's #1 youth companion, old Naledi born social activist. I have 6.5 years doing community mobilization. From all that I've learned and the knowledge and skills that I've gained, I came back to my township to try and help youth become a crop of good leaders in our community. Sexuality or the sexual reproductive health issue has been the core subject in the world. HIV affects our community in many ways. Sometimes HIV affects not only the person who is infected, but sometimes we lose people who are breadwinners in the community. We are at a point where a lot of people don't know how to come out of this problem.
To effectively organise distribution to the clinics and areas that are experiencing an inconsistent supply of condoms, Hero visited local non-government organisations in the hope of setting up partnerships.
We're going to Bonaso, which is Botswana Network of AIDS Services Organization. Yeah, it is an organization that deals with services about HIV. People have been looking for condoms to try help with the fight against HIV.
The prevention agenda is being compromised. The latest numbers that we're getting is that in Botswana every year, we get about 15,000 new infections of HIV, new cases. And that's why I say 15,000, 30 years into the response, where are we going wrong, right? And we think it's time we brought the prevention agenda back to the table. There's still pockets where we feel, we could intervene. And I think you're also coming at the right time where our organization, where we're in the process of reinventing ourselves to say, maybe there's need to take on board the sexual reproductive health agenda for young people. With the exit of other key players that were part of the national response, such as PSI, who were well known for condoms, there's been a huge gap in terms of the marketing or social marketing of condoms. And obviously that speaks to the vulnerability that our people are exposed to.
There's a huge void. Currently, people don't know where to get the condoms. Some people don't know how to get the condoms. With all the money that has been invested in the HIV prevention in the past 29 years, and then suddenly it goes quiet. It's not that government is not doing enough, but I think they are doing all they can. It's only that they need a complement.
Population Services International, or PSI, is a global health organisation based in Washington, D.C. Until early 2015, PSI was the main provider of government-issued free condoms to Botswana. Their exit from the free condom market mean that condoms are now only issued by the Ministry of Health, who face considerable challenges in distribution from their central medical stores, as well as providing a product that is appealing and reliable.
At the moment, everything is centralized. Everything is from the central medical stores. Central medical stores is failing to distribute to all the places.
This is where we have some of our biggest problems. We do have distribution coming from central medical stores downstream to health facilities due to logistical problems.
Hero organised a number of events in the community, allowing them to distribute hundreds of thousands of condoms to the people of Botswana.
This is one of the few events we've had whereby condoms are just being distributed to everybody at one central point, and we're just distributing the condoms and everybody's taking.
These people kind of don't have access to some of these things. So it was quite exciting again for them to be getting these things for free, where they've been longing and trying to get them somewhere and they couldn't get them.
Right now, we just had a fantastic time, doing the football game, giving people condoms. Everyone wanted condoms, and they still want more. And they're still, going to come in and do a lot more activities like this. This is what we do this for, for the social justice aspect of this and making sure that people are looked after to help this country fight the scourge of HIV/AIDS.
A consolidated response between the Ministry of Health, the government, NGOs and those providing donations, in this case Hero Condoms, is essential in ensuring prevention is the top priority in Botswana's national HIV response.
NGOs are very important because they are on the community level. They are on the ground working with people directly.
Having Hero and a few other partnerships that Hero would form in future, where we now get condoms distributed to deep areas in Botswana, that means we are now going towards that vision where we'd have no new infections.
With Hero coming down here, it's not only bringing down the condoms, but it wants to leave a legacy behind. Change is not about changing all the 20,000 people living here. Even changing 5 of their lives is the difference, and that's all what we want.
Every time we should be thinking of a new way of doing things, not always relying on only the old way. Take the old way and bring in the new way so that they all complement each other and go forward. As long as the implementation can be good here, we'll definitely get to see that maybe many will use them. And it's a good donation. It will really help us to prevent and not to have new infections, because I believe prevention is better than cure. I believe that if we see to the point that we continue not getting new infections and those that are infected are given the services, that is very important. It's fundamental, actually.
The only way to know the needs of the community is to be in the community. So having a quality product will be very positive in getting them to hopefully continue using the condoms and accepting to use them.
Initiatives like Hero Condoms can come alongside and try to work together in order to find solutions to how to go about getting the condoms available to people. I see Hero Condoms being part of the future in the prevention of HIV in Botswana.